What happens after a positive CF newborn screening? When a newborn screening test shows a positive result for cystic fibrosis, or CF, several important steps follow to confirm the diagnosis and start early care. Newborn screening for CF usually tests a blood sample taken shortly after birth. This test looks for elevated levels of immunoreactive trypsinogen and checks for common CF-causing gene mutations. A positive result indicates that the infant is at a higher risk for CF, but it does not confirm the diagnosis. The first step after a positive screening is to perform a sweat chloride test. This test measures how much chloride is in the sweat. It is considered the gold standard for confirming CF. The test is done at a specialized care center that has expertise in CF. If the sweat chloride level is above a certain threshold, it confirms the diagnosis of CF. If the results are intermediate or borderline, more testing and monitoring may be needed. If the sweat test confirms that the infant has CF, they will be referred to a CF care center for a thorough evaluation and to start treatment. Early diagnosis is crucial because it allows healthcare providers to begin therapies that improve lung function, nutrition, and overall health. Research shows that starting treatment early leads to better health outcomes and longer life expectancy. In cases where the sweat test results are unclear, or if genetic testing shows mutations that are not well understood, further steps may be taken. This can include additional genetic analysis, repeated sweat tests at intervals such as 6, 12, and 24 months, and other assessments like lung imaging or pancreatic function tests. These measures help clarify the diagnosis and guide ongoing monitoring. Throughout this process, infants who have positive newborn screens but an unclear diagnosis should be closely monitored at specialized CF centers. These centers have multidisciplinary teams that work together to provide the best care. Primary care providers will collaborate with CF specialists to keep an eye out for any symptoms that might indicate CF, which would prompt a reevaluation. To summarize, after a positive CF newborn screening, the following steps occur. First, a confirmatory sweat chloride test is performed at a specialized CF center. If this test is positive, the infant begins early CF care and treatment. If the results are inconclusive, further genetic testing, repeated sweat tests, and clinical monitoring are conducted. Regular follow-up visits at CF centers are scheduled, typically at 3, 6, 12 months, and yearly thereafter. Early diagnosis and treatment significantly improve growth, lung health, and quality of life. This structured approach ensures that children with CF receive timely and accurate care, which can greatly enhance their health outcomes.